Friends, hello to those of you who are already waiting for this unbelievable broadcast. We have so many of you saying hello. Tim Toothy says he's looking forward to this dialogue, and you should, Tim. It's going to be powerful. Brenda, hello, Brenda, joining us from Alberta, Canada, where they just got snow a couple days ago. Dr. Jane Sanjeev, hello. You were our guest a few weeks ago. It's so nice that you're back with us. Thank you so much for joining in. We appreciate you. If you are just logging in, we're going to get our live broadcast started momentarily, but I want to know where you are joining us from and what area, who you are. Make sure that you give the broadcast technology StreamYard permission to use your name, and tell us where you are tonight and what you're up to. I know many of you are saying that you are looking forward to this talk tonight. I know it's going to be very, very beneficial to many of you. We're covering sleep apnea and coming at it from a different angle than we have in the previous 4 live broadcasts. This is our 5th. For those of you who have been following along, this is our 5th. Okay, look at this. We have, this is an interesting name. 107 and Me. Hi, Tammarie and Carrie. Rashida from Delta Sleep in Edmonton. Tammarie is smiling right now because she knows who is joining us. Here we go. Tim Toothy, he said, P.S. Toothy is a good dentist name. I love it. Okay. If I've got this right, Dr. Bain or Eskinder, if I'm saying that right, from Washington, D.C., please forgive me on some pronunciation. Sometimes you log in so quickly. I want to make sure to acknowledge you and let you know where you're joining us from. If I get the pronunciation wrong, don't hesitate to correct me and let me know how I should be saying it. And please do go ahead and introduce yourself. And as you do, we have our guests already in the green room, ready for this exciting conversation. And this really is a conversation. Hi, Ria, joining us from Toronto tonight. I love that you are joining in. And I was just in the middle of saying, this is a conversation. So we need your contributions to it. Well, our dentist and our doctor tonight are absolutely brilliant. We need your questions. We welcome your questions. It's your questions that enrich this conversation. So don't hesitate to join in. And even if it's in the middle of their presentation, I will work in your questions. They're used to it. Dr. Heit has been at this for many, many years. And as well as our other guest tonight, Dr. Solveig Magnusdottir. She is joining us tonight. Brilliant mind. They want to hear from you. Introduce yourselves. Let us know where you're joining us from. So in the interest of time, I can see a lot of you are still joining in, and I will introduce you or put your names up as you log in. But in the interim, I would like to get started because we have so much information that we want to bring you tonight. So as I mentioned at the very beginning, tonight is going to be an insightful discussion and an opportunity for all of you to learn more about the diagnosis and the treatment of sleep apnea and why interprofessional collaboration between dentists and between doctors is so important in the diagnosis and the treatment of sleep apnea. So on that note, I say hello, everybody, our dentists, our doctors, researchers, scientists, and friends joining us from around the globe. Welcome to our 5th live broadcast in our ongoing series about the science of sleep apnea. Every few weeks, we welcome doctors from different disciplines who share their expertise in the diagnosis and the treatment of sleep apnea. So far in this series, we're very proud to say and very humbled to say that we have interviewed a cardiologist, a neurologist, a sleep specialist for both adults and pediatrics, and a medical doctor. And tonight, as always, we are so thrilled to welcome back general dentist Dr. Tammarie Heit. And this week, we're thrilled to have as our guest internal medicine and primary care physician Dr. Solveig Magnusdottir, who will discuss the impact of medical and dental collaboration on the diagnosis and the treatment of obstructive sleep apnea. Medical doctors, as we all know, they are extremely busy in their practice. You will benefit from this talk tonight and will benefit so much if you collaborate with dentists in this area, because ultimately, it will save you time. And tonight we will share details on how a low-cost, simple sleep test that is accessible for all patients, not only for diagnosis by medical doctors, but also to monitor treatment on multiple occasions over multiple nights in both adults and pediatrics, is now available to all healthcare providers. I mean, how exciting is that? Tonight, we're going to dig into this information and talk about groundbreaking technology that can change the face of public healthcare and can ultimately save lives. Collaboration is just so key. If dentists and doctors collaborate, the impact on patients who have sleep apnea is astronomical. Essentially, it can be eliminated. My name is Carrie Dahl. I was a long-time television medical reporter and 6 o'clock news anchor turned public speaking coach and podcast host. I am so honored to continue to serve as your host for our virtual events that we have been sharing with you for the past number of months, and we will continue to share with you as we get the message out there about the importance of that medical collaboration between dentists and doctors. So we appreciate the time that all of you are taking out of your busy lives to listen and to participate in tonight's broadcast and to learn more about the incredible work involved in diagnosing and in reversing sleep apnea. As I mentioned at the beginning, we want this event to be as informative and as interactive as possible. So please, we encourage you to join in on the conversation. I will read your questions and your comments as they come in. You do not need to wait until the end of the broadcast. If there's something you want to ask either one of our experts tonight, simply type your question in the comments box. Also, make sure that you grant StreamYard, which is our broadcast technology tonight, permission to use your name so I can read out who is asking the question and from where, and I promise I will do my best to make sure I get the pronunciation correct. If you choose not to grant StreamYard permission to use your name, you will likely just show up as a Facebook user. So the format for the next 60 minutes will look something like this. So I will begin by interviewing dentist Dr. Tammarie Heit, who is, as I mentioned, the driving force behind these broadcasts, and on a mission to increase more collaboration between dentists and doctors in diagnosing and treating sleep apnea. Dr. Heit is based out of Edmonton, Alberta, Canada. She will discuss her research, the novel approach that she uses, and then, of course, the results. Then we're going to be joined by internal medicine and primary care physician, Dr. Solveig Magnusdottir, who will discuss a low-cost, simple sleep test that is accessible for all patients, not only for diagnosis by medical doctors, but it can also monitor and treat sleep apnea in adults and in children. There's a lot to cover tonight, and research and work in this area is saving lives. You will hear more about that momentarily. We will wrap up our evening and our discussion by 7 o'clock Mountain Standard Time. If you must leave early, or if you want to share this broadcast with someone who was not able to attend, a recorded version of this broadcast will be available on the website www.thescienceofsleepapnea.com. So with that, We will begin, and let's dig in by welcoming Dr. Tammarie Heit, who is the driving force, as I mentioned, behind the broadcast and so determined and passionate about fostering more collaboration between doctors and dentists in diagnosing sleep apnea. And ultimately, she's so passionate about saving lives. Dr. Heit has spent the last 25 years working in general and craniofacial dentistry and lecturing worldwide for 10 years to dentists, to orthodontists, and medical doctors on her published research and findings. As I mentioned, Dr. Heit has successfully reversed sleep apnea, which she will talk about tonight. She's on a relentless mission to get dentists and doctors to work together on the diagnosis and treatment of sleep apnea. What a pleasure it is to work alongside this amazing woman and human being. Join me in welcoming the one and only Dr. Tammarie Heit. It is so nice to see you.
You're awesome.
No, I think you are the one that is awesome. When we talk about like reversing sleep apnea, my goodness, like it's so massive. And I just want to scream it from the mountaintops. Your work is so huge.
Well, I'm very, very excited about it, and it's really fun to work with my colleagues on this. So everybody wants the best.
Let's begin here. You have, as I mentioned, reverse sleep apnea in your clinic collaboratively, and you love this word, collaboratively with medical doctors. So how did you go about actually measuring that? Give us the whole picture behind this.
You've all seen this one in the other broadcasts, and you can get the details of exactly what we did. But essentially, this beautiful young woman came to my clinic, and I screened her as a dentist for sleep apnea, and I thought she might have it. So the way I measured it was I ordered a sleep study, and so she had a take-home sleep study. And when the result came back and it was 118, the clinic that did the sleep study called me right away, and then I called the medical doctor right away because this is a medical condition. It's a very serious systemic disease that needs to be diagnosed by a medical doctor. So called the medical doctor right away. We got her into the hospital, and we did a level 1 sleep study, which, is done in the hospital and in some private clinics around. And her apnea-hypopnea index was actually 128 by the level 1 study. So right there in the hospital, then they could get the mask on her and literally save her life that night. So the CPAP mask went on, and then everybody could breathe a sigh of relief. So she was treated for approximately 7 months before she was stable enough to have the tonsils and adenoids removed. And then we were able to test her again just to see what the result of the surgery was, just to take the blockage out of her airway. And it improved to 70. So 30 is severe. And when I say 30, I mean the apnea-hypopnea index, how many times she stops breathing per hour. 30 is severe. So 70 is still more than double severe. One of the things is she came to me and she said, I don't want to wear this mask the rest of my life. I want to try a sleep device. And we do have the Vivos device, which is, cleared for mild to moderate sleep apnea. And I said to her, well, you need to wear your CPAP with this device, and maybe things will be more comfortable. And so she did. And after 9 months, we tested her because the Vivos protocol is a little different than the other dental devices. We tested her with no CPAP and no dental device. And after that treatment, her apnea-hypopnea index was 1. So then the board certified sleep specialist is the person who reads the data from these sleep studies. Those are the ones that need to give the report. And I just took a picture of the report there, and it says there in the impression, no obstructive sleep apnea with or without the dental appliance. So that's what I mean by reversing sleep apnea. And you saw it's published there in a sleep journal, a medical sleep journal. But the way it's measured, a level 1 sleep study looks like this. Basically, the patient has a bunch of wires and things hooked up to them. This is a polysomnogram done in the hospital, very accurate. It's the gold standard for measuring a person's sleep, so that a medical doctor can diagnose sleep apnea and the severity and things like that. It takes quite a while to get into one of these, usually a year, unless it's in a situation I just described where she got in the same night. I believe the test on average costs between $1,000 and $2,000, but I do know of a clinic in Edmonton that charges $800, and they do a great job. But basically, somebody watches you sleep and takes notes, and they measure your brain waves and your breathing and chest expansion, a bunch of things like that. So it's a medical condition that requires a medical doctor to diagnose that.
Okay, Dr. Heit, you talked a lot about the Vivos device. Yes, I want you to show it and share it, what it looks like. So a lot of people are saying, what is this Vivos device? What does it look like? So give us the lowdown.
Well, there's two pieces to it. This is the top one. It goes in like this. And you can't talk very well with it in. And then the bottom piece goes in like this. And it holds your jaw forward.
Okay.
So
thank you for that demonstration, by the way. It's quite a mouthful.
I wore my sleeves because it would match my dental device.
Perfect. Great choice.
My AC sleeves and dental device. So yeah, this Vivos protocol to reverse sleep apnea, it's FDA cleared for mild to moderate sleep apnea, and it does that by holding the jaw forward. Mm-hmm. But the protocol itself does more, and that's what the device looks like. And I go into detail on how it works in the publication, and we talked about it in some of the other webinars. So, yeah.
Can you give us an idea of price? Is it expensive? Can it be done on children?
Yeah, like the level 1 sleep studies are fairly expensive. They're the gold standard. So the take-home sleep studies are much less expensive. They're between $100 and $600 for a take-home study. And so this little fella here, I was just developing his jaw because we want to make sure there's enough room for his teeth. And he had a very narrow upper jaw. And so there's a dental device. The Vivos device can be used to expand a jaw when it's narrow. Mm-hmm. And the goal is to try to make everything as normal as possible, even attempt to avoid braces. But, what's really cool is, I could test them with a sleep study before treatment to see what the impact on children is. And so you can do these take-home sleep studies on kids, and it's a NOx T3 study, but not everybody can do this. You have to have like a board-certified sleep specialist working with you, and I'm blessed enough to have Dr. Whitman's helping me do this. And my requirement is the parents need to, watch their child sleep through the night. And we just test them kind of before treatment, and we test them again, after they have enough room in their jaws to fit their teeth. So, it takes a couple of weeks to get the report, and, we're really investigating this because of some of the observations we've made with not just the demeanor of the child. Like if the child has symptoms, they seem like they have ADHD, those seem to resolve. Dentists were noticing all these improvements in children when we're just kind of treating their teeth. And so now we can measure it.
A few comments coming in and some great questions. Delta Sleep says, nice demo. They enjoyed that. Thank you very much. Tim Toothy has a couple of good questions here. There seems to be a reluctance of many MDs or sleep labs to collaborate with dentists. Recent patients with AHI of 0.3 was urged to purchase a CPAP after an L3 test. Suggestions for improved collaboration? Is that not the $1 million question we're talking about?
Well, Dr. Tui's really, he's frustrated like a lot of dentists, but don't be frustrated. The medical doctors see the CPAP as it is the gold standard. We need to have treatments, go through clinical trials and things like that. So we just need to keep working. And what we're going to show you tonight is going to potentially really help dentists and medical doctors work together on this. And, we have a internal medicine doctor tonight, and she's very, very, very smart. So
Dr. Tui also wants to know, what is the Edmonton lab that charges $800 for an L1 sleep study?
I think Dr. Cooler's lab. Just try a few different labs. At least I haven't done a level 1 sleep study for quite a while, and the medical doctors send them, but I think maybe the price has changed now, but it is expensive, and the level 3 is expensive too. So
a great question from Dr. Jane. Is the device uncomfortable to wear, or is it worn? And is it worn just at night?
So one of the unique things about this device is it can't be uncomfortable. If it is, it needs to be adjusted. People who wear this device say they feel better with it in their mouth. It changes the spatial relations of the jaw. It actually opens the airway. And people who don't have sleep apnea, they find it helps their migraine headaches and things like that. And there's a bunch of science and reasons behind it. And that's why we want to measure everything. And another reason why I'm excited about this new technology, because it seems that we can get a lot more information from this new sleep image, which I'm excited to show you guys.
One more question from Delta Sleep. AHS at the Edmonton General does not charge, but the wait list is long and you need a referral from a pulmonary specialist or a sleep medicine MD. Just some information to pass along. Okay, go ahead. You were saying you're excited about Dr. Heit.
This here, and this is a ring now. So it's not just an oximeter. It's a ring you can wear on your finger, and this gathers the information that allows the medical doctor to make a diagnosis of sleep apnea. Here's a 2-year-old with this thing on. Now, the cost of this thing is $5 a night, if you can imagine. Like if you want to test your dental device to see where it's at, you don't need the specialist to read it. But if you need it for diagnosis, this has the correct information that medical doctors can use to diagnose this. And Dr. Magnusdottir will go into that a little bit more, but essentially it's $75 for one night to get the diagnosis. And there's a 2-year-old with it on, and I'll show you what the sleep result looks like when it comes back. Basically, you see some colored bars there, and I'll just explain to the patient that what it means. This has to be read by a board-certified sleep specialist, and the medical doctor needs to do an exam and a history and an exam, and then use this information to make the diagnosis. But the data and the quality of the data is there for the medical doctors. So this sleep image technology is only available in the United States and Canada right now. It's called Vivo Score, and it's powered by Sleep Image. It's the only home sleep test that actually is FDA cleared to establish sleep quality and to diagnose the presence of sleep apnea or other sleep disorders in both adults and children by healthcare professionals. So independent reports show a 98% correlation to in-lab, those expensive $2,000 overnight tests That's a huge correlation.
Mm-hmm.
And all they do is wear this on the finger. And to make it even more exciting, you get this report back on your computer the next morning. So basically, I'll explain it to the patient. The green is good, yellow is caution, red is bad. So in this case, the 2-year-old doesn't have sleep apnea, but she has a lot of symptoms that kids will have. And we can see that there is an issue with sleep quality now, and then sleep pathology, which is the fragmentation. And of course, it measures duration, latency, and periodicity as well. So the medical doctor can use this information to get a diagnosis, and then we can also monitor the effects of some of the things we do in dentistry routinely, just trying to help people have enough room for their teeth.
Mm-hmm.
So I'm super excited about this. It's going to make, it feels like the day I got a dishwasher, honestly. You just don't look back. And so I think it's going to take a little bit for people to sort of get used to this new technology out there. But, when you have a choice, I think each medical doctor and dentist needs to really feel like, this is right and it's true and the trials are there and everything. And that's what tonight's presentation is about. So I'm excited for Dr. Magnusdottir to talk about this so that people can see this is real. So which one would you pick?
Right. I mean,
multiple nights with this, and it's not expensive.
It's clear the option is there. Before I let you go, Dr. Heit, just quickly, I know how passionate you are about this. You spend countless hours giving webinars and teaching, and you are in the process of writing a book. Tell us a bit more about it.
The book is so much fun. It feels like I can write the chapters very quickly, but the part that's taking time is just the research. And I'm meeting amazing people, and they're all contributing to this book. And basically, it's got to be a big collaboration between medical doctors, dentists, governing bodies, universities, and even the patients themselves. We're finding out how to do things faster and easier and better. And dentists, this is a medical problem with a potential dental solution, and dentists really know a lot about the mouth. Medical doctors don't feel comfortable looking in people's mouths. At least that's what I'm finding out a lot. So this is pretty fun. It's almost like the book is writing me. It's making me do all these things in my life. So I'm excited.
Well, Dr. Heit, your research is brilliant and your work, and I know that you are changing countless lives. Thank you so much for sharing your research and your passion with us. We look forward to the release of your book. And Delta Sleep does say, I've learned so much from you, Dr. Heit. Also really enjoyed meeting Dr. Singh when you first started this. So that's a lovely comment. I know you've been busy presenting. I'm going to give you some time to catch your breath in the virtual green room, but we will bring you back in a little while, and then we'll have a discussion with Dr. Magnusdottir. But for now, I'm going to let you catch your breath, and we'll join you in a little bit. Thank you so much. On that note, I am pleased to introduce our guest tonight, Dr. Solveig Magnusdottir, who graduated as a medical doctor from the University of Iceland. She has worked in emergency, pediatrics, internal medicine, and anesthesiology in Iceland. Dr. Magnusdottir did an operational tour in Bosnia-Herzegovina from 1997 to 1998. She was a doctor on behalf of the Icelandic Foreign Ministry, serving with the NATO-led stabilization force. She was attached to the British Army and served in 5 different medical centers and theater and with the hospital squadron in Bosnia-Herzegovina. She worked in a primary healthcare clinic in Iceland for 7 years. She is a certified general practitioner, has a master's degree in business administration from the University of Reykjavik, and is an investor and medical consultant with Sleep Image, a privately held company offering traditional sleep diagnostic equipment for the medical market and hospital-based sleep apnea diagnostic services. Sleep Image offers FDA-cleared sleep evaluating and diagnostic solutions, which are based on cardiopulmonary coupling analysis, that's CPC, to calculate sleep quality, sleep duration and opportunity, sleep pathology, and AHI measurements for objective sleep evaluation, diagnosis of sleep disorders, including sleep apnea, and therapy tracking solutions. She is currently working on a master's degree in sleep medicine at Nuffield Department of Neuroscience at the University of Oxford, UK. Oh, friends, this is big. Join me in welcoming internal medicine and primary care physician, Dr. Solveig Magnusdottir. What a pleasure it is to have you with us tonight.
Thank you, and thanks for having me, and good evening, everyone.
Oh, how have you enjoyed the discussion so far? Isn't Dr. Heit's work so exciting?
She is absolutely amazing, and I've seen all your talks, and she's doing great things to help people improve their quality of life, because without good sleep, you will not have good quality of life. So she's doing amazing things.
I couldn't agree more. So let's begin here, Dr. Magnusdottir. Tell me about the reason to start searching for a simple solution to measure sleep. And by simple, I mean it's easy and it's fast and it can be implemented by all levels of healthcare.
Yeah, so some years ago, I transferred from hospital-based medicine to become a primary care physician. And I realized that I had a very high prevalence of sleep complaints. And there's also a high prevalence of long-term hypnotic use. And I had no methods to objectively evaluate sleep before I initiated any therapy. And this led me to start to look for a solution that could be simple enough so it could be implemented into non-sleep specialized care, but it had also to be accurate so I could use it in clinical care. And my first step down the sleep path was investing in a company that was called Embla, and many of you may use Embla equipment because that equipment is now sold by Natus Medical. The sleep image team, we sold the traditional part of the company a few years ago to focus only on the sleep image technology that is based on CPC. And it was through this investment in Embla that I was introduced to this brilliant idea of utilizing the autonomic nervous system and cardiopulmonary coupling to measure sleep. So if you think about it, all healthcare providers, we are faced with the issue that we have a lot of patients that have sleep disorders. And we're just going to focus on sleep apnea tonight. We all know that the prevalence of undiagnosed sleep apnea is very high. According to a report from Frost and Sullivan that the American Academy of Sleep Medicine sponsored in 2015, the agency estimated that prevalence of sleep apnea was about 12%, with the cost of about 150 billion for the society. While the cost of treating sleep apnea is only roughly 30% of not treating sleep apnea. 4 years later, there is another report from Benjafield and his colleagues, and they estimate that sleep apnea is about the prevalence is about 33%. That would raise the cost to about 400 billion. This is a lot of money. And we all know that by treating this disease, we can improve health, quality of life, and save a lot of money. So the question is, why do we still have this high prevalence of sleep apnea? Why haven't we solved this problem? What is the problem that leads to us not addressing this? And I do think this is a multifactorial issue. All medical doctors, we know that we get very little sleep education in medical school. It has been published that the education is about average 4 hours in the whole program. And this is, of course, a big issue with this high prevalence of sleep disorders in the population. The primary care physicians are totally stressed to the limits. So during the short time they have to help their patients, it's very difficult to add a sleep evaluation also into this short period of time. And to add to this is that we have a lack of sleep specialists. So we really need to think out of the box if we are going to try to solve this problem. And I think the first step to hopefully at least improve access to sleep care is to involve subspecialists working under supervision of sleep specialists. And this subspecialist could be the dentist, because dentists, they look at your throat and your mouth, and they really evaluate how you're breathing. And breathing is the key to good sleep. And dentists are willing to participate in the solution. So if we are going to utilize this group of people that is willing to take part with the sleep specialist to solve this, we need simple technology that is low cost, because we cannot spend too much money just to diagnose the problem. We need to have something left to treat patients.
Dr. Magnusdottir, I just want to hop in right there before we get into the simple sleep technology, because you were talking about working together in that collaboration. And here's a perfect example of that. Delta Sleep says, we should not compartmentalize a human body. A body is connected and one part affects another. As a respiratory therapist, this can be quite frustrating. I'm sure you must agree with that comment.
I 100% agree with this. And the key is that if you have poor sleep, it affects all your systems. It affects your endocrine system, it affects your mental health, it affects your cardiovascular system. So it's the key that this is a team approach. We cannot approach sleep in a single compartment. It has to be a team approach.
Okay, so on that note, you were getting to the point of where you wanted to talk about the sleep image technology, a simple, cost-effective solution. So can you dig into that and explain some of the science behind it that actually validates it?
Yeah, I certainly can. And I wish I could take ownership of this brilliant idea, but it's not mine. So Dr. Robert Thomas, he's a neurologist and a professor in sleep medicine at Beth Israel Medical Center in Boston, one of the Harvard teaching hospital. And it's his brilliant idea. And initially, he worked on this idea with his coworker, Joe Meadus. And I was later introduced to this idea through my investments. And I was totally fascinated because it's so simple, but it's so obvious when someone tells you this. So if you think about this, that sleep is very complicated, but we can say that sleep is controlled in your midbrain. It's not controlled on the surface of the brain where we are used to measure sleep. So if you look at the images and think about when you're sleeping, your midbrain is sending signals to the surface of the brain where during polysomnography, we pick up the signals and we read the output and evaluate the person's sleep. At the same time, the midbrain sends signals to your autonomic nervous system that directs the reaction in your cardiovascular and respiratory signals. And their output changes with its sleep stage. And that's why you can utilize these changes in the autonomic nervous system to evaluate sleep in a similar manner as you evaluate sleep from the surface of the brain. And why this is practical is it's so much easier to collect signals from the cardiovascular and the respiratory signal and the respiratory system. And that is the brilliance behind this idea. You can use low-cost sensors to collect the signal, and because the work that has been done on this, what we call cardiopulmonary coupling, shows that we can produce an image of sleep. And that was what caught my attention, what I found so brilliant, that I could easily collect the data and it's automatically analyzed, and I can show my patients their image of their sleep. So how the method works is that we utilize heart rate variability and breathing with very complex mathematical equations. We calculate the coherence between the two signals. Then we apply spectral analysis to the data, and voila, we have image of sleep. So we are very often asked how the method correlates with PSG. And you have to remember, this is not polysomnography, because polysomnography is based on measuring surface brainwaves. That doesn't mean that only polysomnography is a valid method to measure sleep. It was actually in 1930 when Hans Berger figured out to measure brainwaves, and we're still utilizing the same technology to measure sleep. So it must be natural that we will in the future have other technologies that look at sleep from a different angle.
Mm-hmm.
The difference, there are a lot of similarities between the cardiopulmonary coupling method and polysomnography. What maybe is what differs most between the two methods is how we describe non-REM sleep. So if you think about it, if you think about the world, bimodality is very common. We have day and night, we have sleep and wake, and then we have sleep that is defined by non-REM sleep and REM sleep, and this is something that we do too. And REM sleep is defined by phasic and tonic components. But what differs between the two methods is that when you do a polysomnography, we measure non-REM sleep as 3 stages. Stage 1, when we're falling asleep. Stage 2, that is transitional state. And stage 3, that is deep sleep. When you use the cardiopulmonary coupling method, we describe non-REM sleep a little bit differently. We talk about stable sleep, that is the stable part of non-REM stage 2 and all of stage 3. And then we have unstable sleep, that is all of stage 1 and the unstable part of stage 2. So it's really simple, as you can see on the image that you see on the screen. The methods, they correlate quite easily, but you are looking at very different measures. You're either looking at measuring brain waves from the surface of the brain, and you're comparing measures of the autonomic nervous system and the proportion of parasympathetic and sympathetic dominance in the cardiopulmonary coupling method.
So, doctor, you talk about how simple it is with the sleep imaging, but one of the challenges I think we hear over and over again with diagnosing sleep apnea is that it takes time and involvement from multidisciplinary care. So, give us an idea of just like what the workflow would be like and how simple could it be for healthcare providers?
Yeah, definitely. But I think we want to mention, because this is a new technology, but it is not as new as many may think. It has been widely published. The method has been published in over 80 peer-reviewed publications. It has its own chapter in the Sleep Medicine Bible, Principles and Practice of Sleep Medicine. And the method is FDA cleared to be used in both adults and children, which is the key. There are not many methods to measure sleep in children. And I would like to point out a sentence in the FDA clearance is that because we are talking about sleep apnea tonight, the apnea-hypopnea index is the key in diagnosing sleep apnea.
Mm-hmm.
And the FDA clearance states that the sleep apnea-hypopnea index presented when oximeter data is available is intended to aid healthcare professionals in diagnosis and management of sleep disorder breathing. So the FDA clearance states that healthcare providers, if you're a licensed healthcare provider, you can utilize this technology to measure sleep in your patients. Like Tammarie said, you though will need a sleep medicine specialist to make the diagnosis of a disease. And there we have the teamwork.
Okay, so how can this whole method so the teamwork, how can be implemented into the practice for dental offices and undiagnosed sleep apnea?
So that's super easy because everything is conducted through the sleep image portal that is HIPAA compliant, so the data is secure. This is the ring that we are now utilizing that Tammarie mentioned. This is a child with the ring on the thumb. You can see it's super easy for the child to sleep with this, to collect the data. This is a very low cost device. This device costs $299 when the traditional home sleep apnea tests are sold for over $3,000. So you can have multiple devices in your practice and you don't have to wait for the devices to come back. Also, like Tammarie mentioned, because you utilize this device with the Sleep Image app that you download on a phone or an iPod, the data is the only thing that the patient has to do when they go to sleep in the evening is push the start button. And when they wake up in the morning, they push stop. And when they push stop, the data is automatically sent to the cloud for analysis, and the report is generated automatically. So only a few minutes after the sleep recording is stopped, the provider on the other end sees the data. And for the provider, this is very convenient. As we all know, we have issues with all types of medical tests. So if we have signal quality issue, or if we want to see another night, it's easy to connect with the patient and ask them to do one more night of data, which can be very helpful instead of sending the equipment back and forth. And how the system works is then when the data is in the portal, the sleep physician can log into the data, look at the report, look at the raw data, and look at the comments and evaluation of the healthcare provider that initiated the test before making a diagnosis. Then they can write down their comments, and the healthcare provider that initiated the test has the results. So
Wow.
there's not a lot of back and forth.
No,
Just
no, there isn't. A couple of comments and questions come in, Dr. Magnusdottir. So Dr. Jane says, I think more of a comment, and I would be interested in how you respond to this. While this technology measures breathing events indirectly, which is the ANS impact, if I understand your presentation, this is a direct measure of the stress and strain that the heart faces during sleep.
correct. And we actually have an indicator that we call sleep apnea indicator that is directly measuring the strain on the heart during sleep.
Mm-hmm. Okay, another question from Brenda. She says, question for you. If you're wearing a CPAP and in vivo's treatment, can you do a sleep test without the CPAP?
Yes, of course you can do the test without the CPAP. I think the key is what is the end goal. So we have a lot of severe patients that need both the CPAP and the mandibular devices. So if that is the end goal of therapy, then use both the treatment devices. If the end goal with the Vivo's treatment is to get rid of the CPAP, you will need to do multiple nights of sleep testing to find when you have maximized the output or the efficacy of the Vivo's therapy.
And Dr. Jane also says here that we can be qualitatively sleep deprived, but this device seems to be able to measure qualitative sleep deprivation.
Yes, so we have this FDA-cleared sleep quality index, and that helps us to estimate our quality based on the autonomic nervous system and the sympathetic and parasympathetic drive during the night to estimate how well we rested during the night.
One more question before we bring back Dr. Heit here. Vish Raman Krishnan says, can a patient directly purchase it for personal use?
No, they cannot. This method is only for healthcare providers. But what a lot of healthcare providers are doing is that they can sell a device to their patients. For example, physicians that have difficult patients that have a difficult sleep apnea, they sell the device to their patients, and the patients regularly measure their sleep. So the sleep therapist can titrate the therapy so the patient gets the maximal benefit of therapy.
Okay, thank you for addressing that. Dr. Magnusdottir, brilliant discussion. And I know Dr. Heit wants to join in, so I'm going to bring her back, if I may. And I got to say this, Dr. Heit, hearing this must make you so excited.
Yeah, well, I'm thrilled to death because, especially with that last question, that was a brilliant question. I've been asked that by my patients. Basically, yeah, the healthcare provider is taking care of their patient directly, and this is something a patient can get from their healthcare provider to help improve the quality and the efficiency of their care, whether it's from the MD or the dentist or together. And the other thing that is absolutely phenomenal about the Vivo score is I can't express enough how nice it is to have that portal, because all the doctors can just go in and look at the sleep results. You know, some people do it at 3 a.m. So they can all, you know, it comes down to taking care of our patients in a better, easier way and help distribute the workload and work like a team of healthcare providers.
I know both of you are aligned on this issue of saving lives ultimately. And Dr. Heit, you said something to me that was really profound, is like when you became a dentist or a doctor, you took an oath, right? And that oath was to talk about that and how this fits into the bigger picture of what you're trying to accomplish.
Well, I've been just blessed blessed. I was a nurse for 10 years and I've been a dentist for 25 years. And I've worked with so many great people in dentistry and medicine. And I truly believe from my heart, they just really want to take great care of their patients, even though, you know, they come into heated battles sometimes about which is the best way to do things. I think ultimately everyone really wants to take great care of their patients. And, you know, we took an oath and it was do no harm. And I think the biggest, loudest message right now is we can't ignore what's right in front of us. Doing nothing right now is doing harm. Untreated sleep apnea is harmful. You know, I met another patient this week who I just did a big long history on him, and he's only 21 years old. He has an HI of 51, and he's actually underweight, and he's this attractive young man, and he just you know, he just has this diagnosis of sleep apnea, and he started wearing the CPAP right away, and he doesn't really feel better, but he knows how bad it is and he wants to wear it. And this is going to be a great case to collaborate with medicine on. And I think together we're going to be able to help him. But he had symptoms. I asked him if anybody diagnosed him with ADHD when he was a child. He says, well, I should have been diagnosed with it, but my parents didn't want me to take the drugs, and I should have. But like these kids are just growing up like this, and you can just tell they had it in their history, and especially when you start measuring it in children. So you see how prevalent it is. And then we need to know, the dentists, we need the medical doctors, because there's other things like allergies and different things we need to work together on. So this is really big.
Rhea says, Dr. Heit, thank you for saying that out loud.
Dr. Pujo's feeling the same thing in Toronto.
Eskender says, can the sleep device give you sleep onset?
Yes, so like with all home sleep apnea tests, when you get the results back, remember to ask the patient when they try to go to sleep, because they of course can put the ring on their finger at 4 o'clock in the afternoon and walk around with it until they try to go to bed at 11. And then if you look at the sleep onset latency, that would be very wrong. So the key is ask the patient, when did you try to go to sleep? And then you can adjust the raw data so you have accurate sleep onset latency.
Some closing thoughts, Dr. Magnusdottir, tonight. I know Dr. Heit expressed her passion and her goals in educating more people in terms of working together in that magic word collaboration. What are your thoughts in this area?
I think she's so right, and I think that is the key. We healthcare providers, we are service providers. It's about the patients, it's not about us. The key is to improve health and quality of life, and let's start with the children. Let's not let them grow up for years like this young man and realize that 21 years later, we are observing a problem that we could have fixed many, many years before, and hopefully improved his prospects in life. So let's start to ask parents about their kids' sleep, and we have to stop being reactive. Let's be proactive. Ask parents, do something about it, and improve health and quality and sleep of the future generation. And this will not be done without collaboration of dentists, of the sleep medicine professions, of psychotherapists, of physiotherapists. We need all to come together and give the best healthcare that we can.
Can you talk about your experience with the Academy of the American Academy of Sleep Medicine and the article you wrote?
Yes, I did send them a letter regarding what I think is an issue, and that is what we will be talking about. There is an issue with medical schools that we are not educated about sleep. And if you think about it, it's so wrong, because sleep is 1/3 of our life. And we, as a profession, you really, really need to know more about sleep.
Mm-hmm.
The issue is that we need to learn a lot. According to the answer of the academy to me, is that the medical schools are not willing to implement this into their programs. So then we have to start to be initiative. How can we do this? Are the dental schools willing to implement this into the program? There are multiple ways to do this. The program that Oxford University offers, they offer actually a postgraduate program for those who want to further educate them in sleep. You don't have to do a master's degree. You can just educate you get education in sleep.
Mm-hmm.
So there are ways, but we need a lot of people. We have a lot of undiagnosed patients. So we really need to find a way. And I think ASM, they have been trying to educate the population about the importance of sleep, but they may not have been too successful in finding healthcare providers that are willing to educate them to be the subspecialized team that works with the sleep specialist. They are trying.
Look at this, Dr. Magnusdottir, to what you're talking about. Meredith Broderick says, when I chose sleep as a subspecialty of neurology, my department told me it wasn't a serious field.
I guess no one in the department has ever had a poor sleep, because we all have had poor sleep and we wake up the day after and we are not the best version of ourselves.
Right? Thank you for sharing that comment, Meredith. That's so powerful. That is like totally speaks to what Dr. Magnusdottir was talking about. And then Dr. Jane says this, having a device that is this easy to use will increase detection and hopefully treatment of OSA.
Yes.
Well said. Delta Sleep weighs in and says, thank you for this amazing discussion. I love my OSA patients and just wish I can help more people so they can have a better quality of life. Thank you all, from Rashida.
Thanks, Rashida. Yeah, it's the interest in sleep is growing, and I know that was published in 2019 in the Journal of Sleep Medicine from the Academy of Sleep Medicine. So this is very exciting, and everybody on this has to be a leader in their area, and they have to understand the challenges their medical doctors or their dentists are facing, and just support each other and get together, and we'll start all these little groups and really help our patients, and that'll be hard to ignore.
I couldn't agree more. On that note, we have already gone through an hour of discussion.
Wow.
There will be hours more that are coming up. And Dr. Heit, while I have you there, I just want you to go ahead and promote our next guest, because we are doing this again.
Oh, I'm very excited to have Dr. Atul Kular on, and he's a psychiatrist. And he specializes in mood disorders and anxiety. And that's going to be on June the 10th. It's called Sleep, Mental Health, and Dentistry. And, he's brilliant, and it'll be a great discussion. And this is an opportunity for everybody on this call to get more people to come on and ask their medical colleagues. Don't be afraid to phone them up. Remember what Dr. Kashida said. Just call them. Like, for the dentists that are out there going, how do I contact the medical doctors? And I can see Dr. Magnusdottir nodding her head. Just give them a phone call. And I know I did a lunch and learn in a medical doctor's office, and bring some donuts. It's we're all the same. We're the same. So they don't want to look in the mouths. They want us to do it.
Yeah.
So we're happy to.
Well, both of you are brilliant, and I love the passion and the expertise that you spoke with, and the science, that FDA-backed sleep imaging. When you put that up there, that speaks to your work, your research, and the science behind everything that you're doing. I thank both of you so much for taking the time out of your lives to educate everyone who joined in on this live broadcast. Dr. Magnusdottir, we appreciate you and your expertise and the impact you are having on so many lives. And Dr. Tammarie Heit, we appreciate everything that you are doing, and especially the tireless work to build more collaboration between doctors and dentists and ultimately save lives. And I look forward to talking to you again on June the 10th. So thank you to both of you. We appreciate your time and your expertise. I'm going to put you back in the green room and close with a few bits of information. Once again, if you're a doctor or a dentist and you do have questions about some of the things that we talked about, the best place to go for answers or to get trained is go to airwaysummit.com. And if you use the code SLEEPIMAGE, that's all one word, all in capitals, Sleep Image, you can get the course for free. So do keep in mind that is 7 hours of instruction. airwaysummit.com. Use the code word Sleep Image to get that 7 hours of instruction free. You can also go to this website. It is brilliant. It is the American Academy of Sleep Medicine. That's aasm.org for more information. And of course, there is always lots of information on vivoslife.com if you're searching for further answers. To all of you who joined us from around the world, thank you for sharing your time with us this evening. As I mentioned at the beginning of this broadcast, if you didn't get a chance to watch the whole thing or you would like to share this with a friend, all you have to do is go to the scienceofsleepapnea.com and you will be able to find all of our previous broadcasts there, and make sure that you take the time to watch them, especially if you're wanting to get educated in this area. Also, once again, as Dr. Tammarie mentioned, Thursday, June the 10th is our next broadcast with Dr. Atal. He is a psychiatrist. We're talking about the impact of sleep apnea on mental health. So make sure you mark your calendars and take the time to share it with your friends. The more people we can get watching these broadcasts and implementing this into their practices, it is so, so important. Cam Lindsay says, thank you for a great presentation. Brenda says at the end, I love that sleep image device makes testing so inexpensive and so accessible. Delta Sleep says, to sleep or not to sleep is the question now. So well put. I encourage you all to watch the broadcast. Mark down Thursday, June the 10th on your calendars. Check out the scienceofsleepapnea.com for more information. And to each and every one of you who shared your precious time with us, thank you for taking the time to join us. We hope to see you back here on June the 10th. Have a great evening, everybody.